Well, welcome, and thank you for joining me here to get real and get real about patient perspectives and patient portrayals and why they're important, and how patient portrayals are linked to the future and the state of possibility. Again, my name is Maureen Sheltry, and I work for Synovian Pharmaceuticals, and I'm responsible for patient advocacy with our psychiatry franchise. For those of you that don't know, Synovian is a global biopharmaceutical company, and our headquarters are in beautiful Marlborough, Massachusetts, just nearby. Was there a shout out over there from Marlborough? Hey! And we are proud and active members of Mass Bio, and we're just really honored to be here today. So, with all that being said, when it comes to patient portrayals and the patient's perspective, that is something that's very, very important to Synovian. We are, without a doubt, a bench to bedside organization looking at the work that we've done to develop and commercialize therapies for people that are living with serious medical conditions. And that work, along with really paying attention to the patient perspectives and putting the patient at the focus of our efforts to advance science. That's what's important to us. And our commitment goes way beyond the pill. Our business units, regardless of the therapeutic area, they take the time to connect to the patient communities to understand the barriers that different patients and their family members face. Sometimes it's very difficult to get the treatment that you need when you need it, when you're facing certain barriers. But let's face it, not all barriers are the same. Depending upon the disease state, depending upon someone's own life circumstances, their diagnosis, perhaps their family, there are different barriers and they're not all the same. And that's why listening and partnering with patient communities is so important. And when it comes down to barriers, I wanted to share with you today an initiative that Synovian took on in mental health, really to address a barrier that's quite frankly often overlooked, yet very pervasive. And that is the way that people who are trying to live well with a mental health condition are often portrayed. The imagery and language and pictures in the media and really at large in society, they're negative. And they can be very demoralizing. They can be stigmatizing. And it really prevents people from getting the help that they need when they need it, quite frankly. So we took this on. We looked at these barriers, these social barriers, and we partnered with 5 leading patient mental health organizations. Synovian has deep, deep roots in mental health. And because of these deep roots, we were able to build long-lasting relationships with some of the leading patient advocacy organizations and listen to them to truly understand from the patient's point of view what's important in terms of outcomes and what are the real barriers getting in the way. And at the end of the day, what we heard over and over again is that the negative perspective or perception of living with a mental health condition really gets in the way of people getting help. What we did, I'd say, validate is what we already knew, and that is that 1 in 5 Americans, they are living with a mental health condition or have a mental health crisis in any given year, and that less than half of those folks last year were able to get help. That is not good. And again, it drives back to the fact that the need is there, the barriers are there, and what we do know is that when people speak up and they raise their hands for help, that the strong support is increased. The ability to reduce time to diagnosis improves. The ability to get access to care that's appropriate increases as well. We know that speaking up drives wellness and living well and thriving. However, on the other hand, what we also know, again, is that society just doesn't do a good job. They're not sensitive or empathetic about what does it look like to live well and thrive with with a mental health condition. So unfortunately, what you have is shame and fear, and people just want to keep silent and keep it a secret. And we were really looking to flip that on its head and say we're going to replace shame and fear with hope and inspiration and connect people to resources. Because without the resources, people don't have an opportunity to live well and thrive. So that's where we went. Again, we partnered with 5 leading mental health organizations and we launched Be Vocal. Be Vocal, Speak Up for Mental Health. And I honestly encourage all of you to go check out our website, bevocalspeakup.com. And the whole idea was to launch this initiative to say, you know something, that when you get the help that you need, when you need it, you have an opportunity to live well and thrive. We're going to change the narrative about mental health in America. That's what we set out to do, and that's what we're doing. And the picture, you know, when you think of a picture's worth 1,000 words, still, again, even with all of the true life stories, the authentic stories that came through the program, allowed people to take a look and see themselves and say, you know something, I see myself in these stories, and realize that they can reach out, they can get help, and that living well is possible. And again, the strategy was to tell authentic, true stories so that people would be inspired and motivated to speak up and get help and be connected to resources, because ultimately that was the ultimate goal. However, what we continued to learn, so that was year 1, what we continued to learn in year 2 was that, again, whether it's mass media, traditional media, reporting, social media, or just, you know, general pop culture, just the lack of sensitivity about how people are portrayed. You know, language and imagery influences how people feel about themselves, how they feel about others. It influences how people perceive a story or an issue, and we know this. And so we took a look at what is the imagery that's currently out there regarding mental illness. For example, if you were to search on terms such as mental illness, schizophrenia, bipolar disorder, what kind of imagery would come up? Well, let's take a look. Take a look at this imagery. What kind of feelings and emotions does this spark? I see somebody shaking their head no. I couldn't agree more. This does not say that living well is possible. This does not say that there's hope and inspiration. This says, you know something? I better keep my mouth shut. I better off remaining silent and staying hidden. And that's what we wanted to change. So what we did is we partnered, again, we really looked at these images, and these are just 3 images. Can you imagine the images that are out there? I mean, this is just doesn't even hit the tip of the iceberg. So what we did is we partnered with Shaul Schwartz, who honestly is one of the most amazing people I've ever met. He is an award-winning photojournalist. He has traveled the world. He is compassionate. He is an expert at what he does. We partnered with him in Getty Images, you know, the worldwide leader in curating and developing and distributing still imagery. And we got them to partner with us to change what does mental health in America look like. So think of the 3 pictures you just saw, and these are the collection. We followed 10 people across the country, and we curated an entire library. We followed 10 people in their day-to-day lives, and we curated a library of 150 photos that basically show the whole entire spectrum. And these are people living with a myriad of different mental health conditions. To give an idea of what is it to be responsible, accurate, and authentic when talking about mental health conditions and the ability and hope to live well. So take a look. This is a picture of Trey. I love Trey. He's an incredible artist. He's a loving father. He's quite a character, I assure you. Meet Sonia. Sonia is a mother. She's a grandmother. She's retired from the Marines. She is a master Toastmasters. She's an incredible public speaker. She would do a better job up here than I'm doing right now, I assure you. This is Yvonne. Yvonne is an elementary school social worker and a small business owner. Ronald, oh my gosh, we gotta love Ronald. Ronald is a Juilliard trained conductor. He's brilliant, traveled the world. After his bipolar diagnosis, he was terminated and then went on to start his own nonprofit organization with his wife Caroline called the Me Too Orchestra. And this orchestra is designed specifically for people that are living with mental health conditions and the people who love them to work together to make music to show that you can live people with mental health conditions and without and work together. Unbelievable. They do a lot of free concerts. If you ever get a chance to see the Me Too Orchestra, I highly recommend it. This is Susie. You may recognize her. She is a 3-time Olympian. She is an author. She is a wife. She is a mother. And she loves hot yoga. I was there that day. That was scary. She wanted me to join her. I was like, absolutely not. Incredible. And this is Thomas. Thomas, amazing. You don't see it in this photo, but what a smile. He is a decorated Vietnam veteran, and he's living with PTSD. All of these individuals have donated their time, their name, and likeness in perpetuity into this collection, again, of 150 pictures showing the entire spectrum of what it's like to live well with a mental health condition. And I will tell you, you know, if you even just looking at a few of these pictures, you can see the color, there's hope, there's inspiration. The idea is that people will be inspired to get the help they need when they need it and direct them to resources. Our strategy is simple: authentic, true stories that are real, that show the hope and possibility when you can get the help that you need. You know, I don't want to be naive and stand up here and say that, you know, tragedy isn't real, but tragedy is not everything. And these pictures may not do everything for everyone, but it is an example of what good looks like. Getty Images added it to their collection, and these are available free online. They're on our website. They're available for editorial purposes, not commercial. But again, all of these pictures are free to use, and I recommend anyone from traditional media, social media, advocacy organizations. If your child is working for the school newspaper and is going to write an article, these are some pictures they can use. And I think it's important to say that these certainly don't address everything, but it's realistic, it's authentic, and it's something that people can resonate with. And at the end of the day, this is what we want. We wanted to add that to those darker photos that already exist for a better, more real, holistic picture of what's out there. And I will just say in closing, you know, when you talk about, you know, getting real and what does it mean, we're certainly not recommending that everybody here go create a photo library. And getting real is different for everyone, and the state of possibility is different for every disease state. The barriers are different. And what we're asking is for you to get real about what is important for your business and what is important for the patients that you serve. You know, with this job comes great responsibility. So just for example, if you work in clinical research and development, perhaps getting real means meeting with patient advocacy organizations and really understanding from a first-hand account of how a patient or loved one describes what a barrier is or what a positive outcome means to them, and to get that going well before you even jump into the first phase of development. If you're in brand marketing, you know, it could potentially mean getting together with a patient roundtable and sharing with them your messaging and your programs to get their response, to find out, does this really meet their needs? And is it being said the way we want to say it or the way they need to hear it? If you work in social media, you know, it means digging into the forums and finding out what are patients responding to and how are they responding, and using that fodder and education to create meaningful content. So again, getting real means something different for everybody. But what I ask is that you take a look at patient perspectives and patients' point of view and ask them to tell you their authentic, true stories, and then to take that information and create meaningful content for change. It is the right thing for your business. It'll make your business stronger, and it will save lives and make lives better, which is what we're all here for. So again, I cannot thank you enough. This has been an incredible opportunity. I hope that you agree that it was time well spent, and to consider patient perspectives today and for the future for the state of possibility. Thank you very much.